Over the weekend, the White House seemed to be backing off of the idea of a government-run health care plan. Here's Health and Human Services Secretary Kathleen Sebelius on CNN on Sunday.
We don't know is exactly what the Senate Finance Committee is likely to come up with. They've been more focused on a co-op, not-for-profit co-op as a competitor as opposed to a straight government-run program. And I think what's important is choice and competition. And I'm convinced at the end of the day the plan will have both of those.
But today, during a Medicare speech, she affirmed the White House's support for the public option.
Here's the bottom line. Absolutely nothing has changed. We continue to support the public option that will help lower costs, give American consumers more choice, and keep private insurers honest.
All right, what's she talking about? What's going on? And what are the health care cooperatives here that she's talking about? Here's Michael Cannon, Director of Health Policy Studies at the Cato Institute. Michael, welcome here. So as you understand it, is the public option on the table, or is it off the table, or does it depend on which day of the week it is and what audience she's talking to?
Well, it depends on what you mean by public option. When the president says public option, he means whatever you want public option to mean. When the House Democrats say public option, they mean Medicare for people under age 65, while Senate moderates mean something like a co-op, and they're not going to tell you what that is just yet.
All right.
So the president is being deliberately vague, and I think it's really catching up with him because it's upsetting people in his own party.
Right. That's so that whatever they get, they can declare victory and go home. But we all know what Medicare would be for people under 65. And I think you're right. That's what the left in the Congress and throughout the country sincerely wants. And that's what the president campaigned on. But when the president sort of seems to be stepping back a little bit, like he was personally himself, and like we saw Secretary Sebelius do, and suggest medical co-ops, what are they talking about? What is a medical co-op, Michael, and how would it work?
Well, what a cooperative means is that the members govern the health plan. So the members are like stockholders. They elect the management team. They're the ones who are in control. But think about if the government charters this new co-op, how many members are there going to be on day one? There aren't going to be any. So who's going to be running this new program? Well, the government's going to be running this new program. So, in effect, it could be exactly the same program as the House Democrats want to see. It could be Medicare for people under age 65. We're just calling it a co-op. We've just renamed it because we think that will sell with some moderates in the Senate.
Oh, Michael, the government wouldn't
really
do that, would it? The government wouldn't just change the name of something so it would sound more palatable. They wouldn't take Medicare for everybody and call it a co-op and make us think we had some decision-making power.
Do you pay much attention to the government?
Oh, man, this is unbelievable. All right, so the government will just take Medicare for everybody under 65 and call it a co-op and declare victory. Would it still have the same type of regulation that this 1,100-page bill that very few people in either House of Congress have read, would it still have those type of regulations in there?
Well, that's the thing. No matter what kind of government-run health care plan the Congress and President Obama create, it's not going to be governed by the same rules that govern private insurance. So they're going to be able to pull people out of private insurance and into the government plan and effectively, eventually, eliminate private health insurance. But you know what? I think the most striking thing that Secretary Sebelius said was that the president wants choice and competition. If you look at the rest of the bill, the regulations that he wants to impose on private insurers, those are going to eliminate almost all of the low-cost options, health insurance options that are available on the market now, and the more comprehensive options that are available on the market now. So most Americans are going to have to give up the health plans that they have and like right now, and we're all going to be marched into a narrow range of plans, or maybe a one-size-fits-all plan, and that's just in the private sector. That's before any competition from a new government program takes hold and starts pulling people away.
I got to tell you.
So I think that choice and competition is the last thing that this administration wants.
I got to tell you, I agree with you, and it drives me crazy when they talk about competition. A, they don't like competition because they believe the government knows best. B, if everybody is taxed for the federal program, what incentive will there be for employers to pay premiums to insurance companies to provide insurance for their employees when the employees are paying taxes anyway? C, You can't compete with the government. The government owns the stadium, the government lines the field, the government is the other team, and the government is the umpires. So the government will tilt the playing field to favor itself or to favor its patrons. It's impossible successfully to compete with it. So the government, tell me if I'm wrong, the government will drive private insurers out of business, Michael.
Like a kid's lemonade stand competing with Al Capone. That's the kind of competition you're going to see between private insurance and the government.
All right. Don't even mention lemonade stands. We have a story in New York where the police arrested a 10-year-old with a lemonade stand because she didn't have the permit that the city issued. But maybe that's where we're going. Maybe these people in Washington really want to regulate so many aspects of our lives. They don't understand competition because the government doesn't make wealth or prosperity. It just consumes. Won't the same thing happen under this program, whether you call it Obamacare, federal option, or a co-op?
Absolutely. I think that if the administration wanted choice and competition, there'd be a couple easy steps it could take. One of them would be just let people purchase health insurance from a state other than their own. If employers and individuals can purchase health insurance across state lines, you're going to get a massive increase in competition because there's going to be so many more health insurance options in every market, and that will keep the insurers honest. Why do they think that one health insurance, one new entrant into the marketplace is going to do that?
Why can't we have health insurance the way we have almost any good that you want to buy? Why is it that, for example, in New Jersey, where I live, I have to buy the Rolls-Royce of health insurance policies? It's the only one the state will let anybody offer. Why can't private enterprise compete for my business by offering me a policy that I want and my neighbor a policy that she wants, rather than one size fits all?
Well, because the special interests who want to force you to buy that stuff don't want you to be able to leave to avoid those regulations. But if you could buy health insurance from Pennsylvania, you'd be able to buy a much more affordable policy. You would be able to save money on your premiums. You would have a policy that matches your needs and your family's needs. And so would other residents in New Jersey, as well as Pennsylvania and all the other states. We would be able to make a serious dent in the number of uninsured Americans, and it wouldn't cost the government a dime. It wouldn't cause taxes to go up by one dime.
Thank you, Michael. Michael Cannon from Cato, thanks very much.